composite bonding is a really beautiful technique that allows, particularly for younger people these days, allows really major changes to their smile and to their appearance, but without doing any damage or anything irreversible to the teeth. Hi, my name is Mark Flynn. I'm a general and cosmetic dentist at the Modern Dentist in Shoreditch. I'm going to talk about composite bonding today. So composite bonding is a beautiful aesthetic procedure that's used increasingly in cosmetic dentistry these days, which is reversible and completely non-invasive to tooth structure. It involves bonding a restorative material called composite, which is almost identical in appearance to tooth structure, to the tooth to change its shape and appearance. So the reason why composite bonding has become such a popular treatment these days is that primarily because it is non-invasive, it allows people to make the changes to the teeth, but in a way that doesn't compromise the actual tooth structure. But what makes it different is the advances in technology and materials that have happened over the past few years in dentistry that allow us to create something beautiful and long-lasting. So the biggest change that's happened in dentistry in the 21st century is the switch from analog to digital dentistry. With composite bonding these days, this allows us to use digital scans and photography to very accurately plan the changes that we want to make to your teeth and your smile. And very importantly, it allows us to try in your new smile so that you can test it and make sure that you like it before we do anything permanent to the teeth. The other major change is in the materials themselves. So traditionally, composites were not particularly aesthetic. They were broadly the same color as teeth, but they didn't really look like tooth structure. They were very opaque and dull, and so wouldn't have been able to be used successfully for what we use them for in composite bonding today. Whereas these days, the materials that we use are often completely indistinguishable from the different layers of a tooth, which means that they can mimic tooth structure perfectly. So this is why we don't need to remove any tooth structure. We can just add the material to make teeth bigger, to make them thicker, and they will look exactly like real teeth. Some things to be aware of when making the decision about either composite bonding or something like porcelain veneers. The first thing is that composite is not as tough as enamel or real tooth structure. This means that it will tend to age faster than tooth structure over time. So, for example, especially if you're someone who grinds their teeth or clenches, realistically, in a few years' time, that composite will have aged much faster than your own teeth. This means it often has to be touched up or polished to maintain it, and in some cases, after a few years, it will need to be replaced. Another thing to be aware of is that, particularly for complex cases, composite bonding is a very highly skilled technique. And so ideally, you need someone doing this procedure who does quite a lot of it in order to make sure that you end up with something that really looks beautiful, but most importantly, lasts and stays beautiful over time. So the first stage in the composite bonding treatment is where we'll carry out a consultation where we'll assess what it is that you actually want to change about your teeth, whether it's one tooth, multiple teeth, whether it's an entire smile up with the upper and lower visible teeth. And then from that point, we will take a full set of records, including digital scans and photographs, and do what's called a digital smile design. This is where we mock up the new smile and we send this to the lab so that they can create a digital wax up of your new teeth. And then the second stage in the treatment is where we use this wax up and transfer it to your mouth so that you can see how the new teeth look in a temporary material that's very, very similar to the final composite that we'll use. We get a full series of photographs again at this point so that you can decide whether you actually like what we've done with the changes to the teeth and to the smile, or whether you think, for example, they're too long or too short. And if that's the case, then we make the changes to that we go back to the lab, make the changes that you want to the smile, and then repeat the same process. And so only once we get to a point where we're happy with the appearance of the teeth and you're happy that they suit your face and feel comfortable and look really great, then we get you back in for the actual bonding procedure. This, depending on how many teeth we're doing, can take anything from an hour up to a full morning or an afternoon. And this purely depends on the number of teeth involved and how much work we're doing to each tooth. The procedure doesn't usually involve any anesthetic because we're not doing any drilling of tooth structure. Usually the only time we would numb you up is if there is old composite bonding or old restorative material that we need to remove from the teeth. Then we'll sometimes numb you up for this, but otherwise the procedure is completely painless. Doesn't involve any drilling, doesn't involve anything uncomfortable. Afterwards, once the procedure is finished, you can use the teeth immediately. They should immediately feel very comfortable. You should be able to eat normally, and we'll usually just see you for a review 1 to 2 weeks after to make sure that everything is settled with your bite and with the appearance, and to make sure that you are loving your new teeth. So all in all, composite bonding is a really beautiful technique that allows, particularly for younger people these days, allows really major changes to their smile and to their appearance, but without doing any damage or anything irreversible to the teeth. So you can always change your mind and decide to do another treatment later.